This is Clayton Matthews with Maryville University. This is my head-to-toe assessment. This is our patient here. You can see are his initials. We're going to perform this assessment before we came into the room. His vital signs were taken. His height and weight were done. He emptied his bladder. I washed my hands. We conducted a vision test with the Solon chart and also the Rosenbaum for the nearsighted test. Okay, we're ready to begin. We're going to begin by palpating the patient's head, checking for any indentations, and just making sure that his head is normal cephalic, which it is. We are next going to inspect his skin on his facial area, check his symmetry, also check his cranial nerves while we're here. So if you would, I want you to go ahead and wrinkle your forehead, squeeze your eyes. Okay, just one at a time. Squeeze your eyes. Okay, wrinkle your forehead up if you can. Thank you. Puff out your jaws. All right, smile. Stick out your tongue. All right, thank you. Next, I am going to go ahead and palpate his around his eyes, checking his lacrimal apparatus. Also, before I do that, we'll note that his eyebrows are full of hair on both sides, and his eyelashes are outward. Okay. Also, I'm going to go ahead and palpate his sinuses while I'm here, doing the frontal and the maxillary. All right. We're next going to check his ears. And what we're looking for is first, we'll visually inspect his eyes, but before we move to his ears, I also want to check his the sclera and the conjunctiva in his eyes by looking at them. We'll use the pen light just to go ahead and get us a little more light. And we're checking to make sure there's no discharge, any redness, and none is noted. Next, we'll go ahead and check his fields of vision. I want you to go ahead and look at this light, and if you would just follow the light, but do not move your head, okay? And we're looking for any abnormal jerking or motion, which there is none. And we'll also get him to cover one of his eyes so that we can check his peripheral vision. Thank you. If you would, tell me when you see my hand, just say now. 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 Okay. We're going to now do the other side. All right. Now. 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 Okay. Thank you very much. All right. He has good peripheral vision. We will next go ahead and inspect his nose. We will look for the nasal mucosa. It should be red and moist. We're also going to look and check his turbinates and his nasal septum. All right. Hang on. Look in there. His turbinates are normal, and his septum is not deviating on nasal sides, which is good. That's the way it should be. We'll go ahead and inspect his mouth while we're here. We're going to look inside your mouth. And while looking in his mouth, we're inspecting the uvula. We're inspecting his tonsils. We're looking under his tongue. We're inspecting the hard and soft palate. And we're also looking at his gums for bleeding. We're looking at his teeth, noting the color, the consistency, noting if he has any missing teeth or any obvious cavities. I'm going to go ahead and get a little Q-tip here so we can go ahead and check his gag reflex while we are doing this. Also, while looking in his mouth, we're going to note the anterior pillars and his nasopharynx. All right, if you would, just say ah. All right, thank you. He has a good gag reflex. All right, now we're going to check his neck. That's the next thing we're going to check. We're going to check for jugular vein distension, and then we're going to perform a passive and an active range of motion check on him. Okay, he doesn't have any jugular vein distension on either side, so we'll go ahead and get him to move his head if you would. Would you put your ear towards your shoulder. Okay, now the other side. Please touch your chin to your chest. Now back. All right. Now we're going to do the same exercise but with a little bit of resistance, okay? All right, you can move forward. Thank you. All right, to this side. All right, to this side. Okay, back. All right, thank you. You did that test with no difficulties. We're going to also have you shrug your shoulders up and down, if you would. Okay, now we'll do that one more time with resistance. All right, thank you. Now we're going to palpate and check. First, we're going to check his trachea, and then we're going to check his thyroid. So the first thing we're going to do is check and make sure there is no deviation. Sure is not. Now we'll check his thyroid. It's like, right, could you swallow for me one time? And it should feel smooth, which it did. So there are no problems. We're now going to palpate and check his arms. We're going to check the pulses in the brachial and the radial. Brachial, radial again. We'll now finish palpating. We also check his capillary refill, noting that it is less than 3 seconds, which is what we want. Okay. Now we're going to inspect his back. So if you would, please turn to this side, putting your legs over the end of the table. Okay. First, we're going to go ahead and palpate his back, noting for symmetry on both sides. All right, we're going to palpate. And percuss. All right. Now we're going to check his lungs. We're watching his respirations, noting his lungs are expanding even, and they're unlabored. They're less than 18. We're going to also check his diaphragmatic excursion, but first we're going to check him for tactile fremitus. With the palmar aspect of my hands, I'm going to get you to say 99 for me, and just keep saying it until I tell you when you feel my hands touch your body, okay? Say 99.
99, 99, 99,
Okay.
99, 99, 99.
All right, thank you. If you would just lean slightly forward for me, about the space of the 10th rib, I want you to go ahead and take a deep breath. We're noting for even expansion on both sides. Okay. Now I'm going to go ahead and auscultate his lungs. I'm going to listen to him posteriorly first, then anterior, and then lateral. Okay. Now we're going to listen to his lateral side. Okay, if you would, face front. We're going to listen to him anteriorly. For his lungs. Okay. Now we're going to inspect his chest for symmetry, respiratory effort. I'm also going to place my hands over and letting his chest rise to my hands, feeling for any pulsations or anything that might be abnormal like that, any thrills, heaves. There is none. We're also going to check now for his apical pulses. And by checking under here. I'm also going to check his clavicular nodes and the axillary nodes. Alright, now I want to listen to his heart sounds, starting with the aortic, pulmonic, Irv's point, tricuspid, and mitral. That was with the diaphragm. Now we're going to do the same thing with the bell. Aortic, pulmonic, Irv's point, tricuspid, and mitral. Okay, if you would, please turn to the side and lay down. I'll pull this out for you. We're going to take a look at his abdomen. First, we're going to inspect for the contour, and we're going to look his stomach over. We can also, at this time, you can use tangential lighting to go ahead and see if there's any fluid-filled masses or areas. There are none. We will now go ahead and auscultate all 4 quadrants for bowel sounds. If you did not hear any bowel sounds, you would stay in each area for 2 minutes. If then none, you would wait up to 5 minutes. Next, we're going to go ahead and check his arteries. We're going to check the aortic, the renal, iliac, and femoral on both sides. Now we're going to go ahead and percuss his abdomen, looking for his liver, which would be on the right side of the abdomen. So we're going to go ahead and look at the costal margin for the liver borders, and that would be on his right side. Which, when you feel it, you can go ahead and mark that area with a pen, and then percuss straight down. Okay. Next, we're going to go ahead and we're going to palpate the abdomen, feeling for any abnormal areas or masses or something that might be present. First, we do light palpation. You can also palpate for the aorta. Next, we're going to go do deep palpation. All right. If you would, please turn on your right side for me. On the left costal margin is where the spleen should be located, and you can percuss for it. Okay, if you would turn back. Okay. Next, you can attempt to palpate the rest of his abdominal area. You should not be able to palpate the spleen under normal circumstances. Also, if you would just sit up for me a little bit. Thank you. That is to check his abdominal muscles that you can feel. Next, we're going to go ahead and look at his legs. We're assessing for hair distribution, muscles, mass, and the skin quality, texture. And we're palpating, and we're going to check for temperature, edema, pulses. And we're going to begin first by looking at his hair distribution on his legs. We're also noting that the temperature is normal and that there is no edema in this case. Next, we will check the pulses, beginning with the popliteal, which is behind the kneecap. We will check the posterior tibial, the dorsal pedialis, which he has. Check this side. Okay, just stay in that position for me. I want you to tell me, we're going to check his sensation. I want you to tell me if it's, close your eyes, and I want you to tell me if you feel something that is hard or soft or sharp, excuse me. Okay.
Sharp. Soft.
Okay.
Sharp.
All right. So he has good sensation on both sides. All righty. If you would, please sit up for me. I'm going to get you to step here in front of me. Turn around. All righty. What we're going to do is first I'm going to palpate his spine, starting in the cervical area, working my way down. And next, we're going to have him bend forward. If you would, please bend over for me. And we're going to check his spine to make sure that it doesn't have any kyphosis or scoliosis, depending on the curvature of the spine, which he has none. Thank you. Sit up. This concludes my assessment video. Thank you.